Okay, we're here today with Willis. And Willis, we're going to talk about that knee pain that brought you in, one of the reasons why you came into the office today. How long have you been dealing with the knee pain?
10 years.
Can you put your mask down so we can hear you? Because it's hard to pick up the sound.
10 years.
10 years, okay. Have you seen any other doctors for that?
Yes.
And what have they done for you?
Some physical therapy.
Okay.
And of course medication.
Okay. No surgeries or anything?
Not recently. In the past, I've done several surgeries.
On the knees?
Yes.
And what did you have done?
I've had multiple arthroscopies, and then both knees were replaced 17 years ago.
Okay. So what are you feeling on a typical day with the knees?
Pain, difficulty walking, losing my balance.
Okay. So those are the things we need to get you back to doing.
Correct.
Now, from talking earlier, your right knee is worse than your left knee.
Yes.
So what is the discomfort today in the right knee?
Right knee would be about an 8 right at this moment, yes.
And the left knee?
Left knee's maybe a 1.
It's doing good today.
Yes, today's a good day for the left knee.
Okay, good. All right, so I'm going to have you do a couple things for me. One is just going to be, I just want you to stand up. Did you feel any discomfort when you did that?
Yes.
And where did you feel it?
In my right knee and in my feet.
Okay, could you point to where it's hurting you in the right knee?
It's right in the center below the kneecap.
Below the kneecap. Okay,
Yes.
perfect. All right, and you also felt it in your feet?
Yes.
Okay. I'm going to have you take 2 steps forward.
Can I use my cane?
Yes, you can. Feet shoulder length apart.
All right.
Arms out in front of you.
Yes.
And I'm going to have you squat down for me.
All right.
Slowly come back up. That's a darn good squat. And did you feel any discomfort doing that?
Oh, yes.
And where did you feel it?
In my knees and my ankles.
Is it in the same spot below the kneecap as you
Yes.
were from sitting to standing?
Yes.
Okay. I'm going to have you go up and down the stairs for me.
All right. Okay.
Okay. Okay. So it was obviously more difficult going up the stairs than down.
Yes.
Okay. And were you feeling it in the same spots?
In the back.
Back
also
that time?
coming up.
Okay. Plus in the front below the kneecap.
Yes.
Okay. All right. I'm going to have you have a seat back there on the bench. Watch your glasses there.
Yeah.
Don't sit on your glasses.
Yeah, really.
Okay, now I'd like to talk about the neuropathy that you're experiencing. How long have you been experiencing that?
About 6 years.
Okay.
Yeah, 6 to 8, I guess. Yeah, about
Okay. And what do you think is causing that problem?
so many surgeries over the years and injuries, and I think my guess, of course, just nerve damage, I would assume.
Okay. And how is this affecting your life? Like, what is a typical day like for you?
Uncomfortable.
Very uncomfortable. What kind of
Yeah.
symptoms are you feeling?
On the neuropathy?
Yes.
It's like you can't feel the ground a lot of the time. It makes balance very difficult. Shooting pains, almost like the pins and needles.
Do they go up your legs?
They do, yes.
Okay.
Yes.
And you've had this for 6 months?
6 years.
6 years. I'm sorry, 6 years. I wish it was only 6 months.
Yeah, really.
All right. So one of the goals that we're going to set for you is to improve your balance.
That'd be good.
So we've got to get the feeling back in the extremities, and then we got to improve your balance. So that's what you're here for, right?
Sounds good. Yes, ma'am.
Let's get started.
Oh my God.
Yeah.
Oh my God.
Don't you
are
start
kidding.
crying.
Holy crap, holy crap.
Feel looser?
Holy crap.
Okay, take your mask off and say that. Really loud.
Oh my God.
So obviously you've noticed a change. Look.
Oh
wow.
my Lord.
And you're not even using your cane at all.
No.
Yeah.
Not at all.
Oh my God. Okay, that is.
I
worth
could
every
kiss you.
penny.
Just pace yourself.
kidding.
I'm not shitting you. Years, excuse me.
Yeah.
Years.
That's worth every
Yeah.
penny, just if they never did anything.
We're, all right, we're back with the man of the hour. This is Willis, and Willis has finished his treatment with Dr. Davis, and Willis is on cloud 9 because
Oh,
he's
my
feeling
Lord.
so much better. So, Willis, I'm going to stand up for me. If you can
Is this-
stand up,
Is this really happening?
we're going to take 2 steps forward.
Oh my God, I'm afraid to try it now. Look at it.
All right, now I want your arms straight out in front.
Oh.
Back up a little bit.
Oh,
We're
yeah.
going to do a squat. Okay. All right, arms out in front. I'm going to have you squat down and do it slowly. Please do it slowly. That was pretty fast. Oh my gosh. Now come back up. Any pain there?
No, I mean, minor.
Let's do the stairs now. This is amazing.
It's habit. I want to grab the rail.
It is, but I want you to hold on to it just in case. Now you're going to have to think. There you go.
Yeah. I
There
gotta
you go.
think about it.
Because your brain is used to you doing it the other way. Now we're
Look
going
at
to
that. And
go.
now I landed on the ball of my foot and used my ankle. I haven't done that in years.
Because your foot's able to move a little bit more.
Oh my goodness.
Willis, tell me.
Yeah!
So, I'm going to have you turn around for me. What changes have you noticed? What is different from when we started until now?
It's the first steps in how many years that I have taken without a cane or a walker.
That's great.
I mean,
At least 6.
I know one of your biggest things was your balance. Do you feel like your balance has
yeah,
changed?
I mean, I can feel, in just a little bit, I have more sensation of the ground
Okay.
and I feel more balanced
Okay.
already. I mean, it's just,
And we haven't even done therapies or anything yet.
I know. I mean, just that, holy mackerel.
So what do you think your discomfort level is now? You started off with, was it an 8 or a 9?
Yeah.
Yeah.
Crabby.
I'm hard to. It's hard for me to even say. I mean, I want to say nothing, but that doesn't sound right coming out of my mouth. if
It
that
doesn't
makes
seem
any
logical,
sense.
right?
It's not logical. I feel minor sensation in my left foot. But even that's better.
We've got the communication open up so all those muscles can work
Holy
like they're
mackerel,
supposed
I
to.
never would have thought this. I mean, not that quick. I mean,
What would you tell other people who are kind of like on the line? They don't know if they want to do it or not.
why the hell are you not here yet?
Exactly.
That's what I would tell someone right this minute.
All right, Willis. Thank you very much, and let's go get you started on some
I want to
therapies.
walk around, Becky.
Oh, are you gonna show off?
He is.
He's gonna show off now.
He has a.
Action.
Hi, it's Dr. Robert Davis with Active Health Knee and Shoulder, and I am here with Willis, and Willis was kind enough to come on and tell us about his experience in our office. He came in to see me for chronic degenerative knee pain. I'm going to let Willis tell his story, so if you can just tell us a little bit about your history and the surgeries that you've had, the problems that you've had over the last few years, and then your experience coming in the office and how you're doing now.
Okay. Over years, really, just over the past 25 years, just multiple injuries, ankles, knees, both. Eventually had left ankle operated on nearly 40 years ago. Knees replaced 17 years ago.
You're in the military, right?
In the military,
Yeah.
correct.
Yeah.
And for a little while it was good, and then of course everything started to go down. I gained some weight, a lot of weight, and that did not help. And got rid of the weight, but even during that time frame, got to the point that the numbness, the tingling,
Right.
unsteadiness, and it just progressed. I'd say within the past 6 years, when it really started to notice it, say 6 or 7 years ago, and it just got progressively worse. And finally got to the point that, half the time I couldn't even have a clutch on my truck, couldn't even feel the clutch half the time, couldn't feel the ground, and started to affect my balance, started falling, and the pain was at times just
In the
through
feet-
the
in the
roof.
feet or in the knees?
In the feet. It
In the
was
feet,
really, I guess the feet kind of exacerbated kind of what was going on with the knees, because of the unsteadiness and everything else. And swelling, really, my foot, by 10 o'clock every morning, my foot would be the color of an eggplant, you know, from the swelling and everything else. It was really bad, but now I feel like I told you the other day, I feel like now there's honestly light at the end of the tunnel.
Yeah.
I mean,
that's a
because
good
I
feeling.
knew I had been told that, you know, there's really nothing else. I've been through that trap, if you will, of so many different medications
Right,
that absolutely did no good whatsoever. And you offered something that I hadn't heard. And we've seen your little infomercial on
Right,
TV.
yeah.
And that was it. My wife actually talked me into it because I had heard so many stories about other people doing other things, you know, yada, 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 it don't work. But from the very first time, I mean, I really feel like I have hope. I feel that, you know, I'm not necessarily, hopefully,
Yes.
some of those surgeries will not have to be done. I feel like right now that the path that you have put me on between the supplements, nutrition, and the therapies and everything that you do here and then I do at home,
Right.
I feel it's incredible. I mean, I'm not perfect, you know. Of course, it's a long road. I realize.
Yeah. How many
I
days in is it now?
10 days.
Yeah, I think it's just.
You know, like
yeah.
10 days, but it's just, I'm just amazed every morning, and my wife's the same way. You know, it's like, I just can't believe where you are in a short amount of time. But you know, every time I've ever tried to do anything in my life,
Right.
it's full speed. You know, it's like
Yeah.
start to finish. You know, if somebody says it takes a month, I'll do it in a day.
Right. Right.
You know, but now I feel like I understand this is a marathon. It's not a
Right.
sprint.
Right.
But I feel pretty dadgum good right now.
Good,
So
good,
I'm
good.
I'm very happy that I'm here.
That's
I appreciate your help.
Yeah.
Everybody.
So let me just ask you a question about that first visit. 'Cause you came in the first visit. Now, Willis is here for his neuropathy, but he also had 2 knee replacements.
Both, yes.
More than one surgery on each one? Or?
I had
One?
multiple arthroscopies before we got to the knee replacement.
So you're having a lot of trouble
Oh, a lot.
walking when you
Oh.
first came in. I mean,
Yes.
like you said, you're not running a marathon now.
Correct.
But after the first visit, it was pretty significant, the improvement that we saw. I mean, I was even impressed about how well you walk.
And I didn't mention that, but you know, I had got to the point where, I guess it was 6 years ago.
Yeah.
I had to start using a cane.
Uh-huh.
And more and more and more all the time. You know, that cane was there at first, it was just a little bit to keep myself steady.
Yes.
But then it got to where it didn't matter one step, I better have that cane or I was
Right.
going down.
Right.
And the very first day, I mean, literally 6 years
Yeah.
having that cane in my hand.
Yes.
As you well know, I got up off that bed
Right.
and I walked
Yes.
without a cane.
Yep.
You know, that was like, you know,
Yeah,
it was
absolutely.
biblical as far as I was concerned.
It was awesome.
It really was.
And-
I
and
was amazed.
So what that goes, why that happens, and this happens with a lot of people that come in if they're having chronic problems with their knee replacement, it's because they had the knee replacement. The doctor did a good job. He put the new knee in. It's working. It's bending properly, but they forgot one of the. It's still on there.
Yeah.
They forgot one important component, is that prosthetic knee works the same way as your natural knee. It needs power from your brain going down the spinal cord, across the lumbar nerve plexus, to innervate the muscles around the knee so that knee can unlock and bend and do all the things that it needs to do. So we just treat people that come in with problems with their prosthetics just like it's a natural knee. We do almost the same thing. And 9 times out of 10, they notice significant results. So I'm so happy for you because, I mean, it was like, I got a little misty watching, like, this guy really, he hasn't really walked. You know, you
Yeah,
take it for granted
exactly.
sometimes what we're doing here, but it's really transformed people's lives. So thank you for that.
It really is. And to me, it's so, traditional medicine it's got to have things, you know, in traditional medicine.
It's
It has to be
emergency
done. But
medicine,
this
that's what it's
here,
good at.
Exactly.
Yeah.
You know, to me, it's a new frontier.
Yes.
You know, and it's another avenue for people
Right.
that don't want to go down
Yeah,
that, you know,
yeah.
popping all the pills and
Yeah.
everything else. So I am so happy.
Awesome.
So happy that I found you guys, definitely.
Yeah. So we'll keep moving in the right direction. Thanks so much for
Good.
doing this for us. Thank you.